Hello everyone and welcome to our training video. This is a training video on how to put in discharge orders if you get them telephone order. So the first thing we're going to do is we're going to open up Optimum. You're going to go ahead and sign in your username and password as you normally do. We're gonna go ahead and find our patient. So for this example, I'm gonna use this patient here that you see. I'm gonna click on the patient's name. And we are gonna go into order entry. So to find the discharge orders, we have to change our order panel to the physician order panel, which is called physician panel index. We're going to go ahead and go into the internal med physician panel. We are going to scroll down to the discharge orders. So for discharging, we have an order set. It's called an internal medicine discharge orders set, and this is where we're going to get our orders. Before we click on our order set, we're going to make sure our properties are set correctly. Order option will be telephone. We're going to go ahead and set our physician. I'm going to change my physician to my test doctor, Dr. Pax, and click submit. Cosign physician and order type can be left blank. And now I'm going to select an order priority. I'm going to go ahead and select routine for this example. Now to access an order set, do not click on the words. You have to click on this icon, this paper and chain link icon. You're going to get a pop-up that's called an order set pop-up, and you're going to see all the choices for the discharge that you can pick for your patient as you scroll down. So I'm just going to pick a couple for this example. So as usual, we should just DC our IVs. So I'm going to go ahead and pick that. I'm going to pick discharge to home. And there are different places and areas you can discharge your patient to. We have different choices: discharge to home with services, discharge to SNU, and you can pick whichever pertains to your patient. We have another section here that you can choose for special equipments for discharge. You can pick any of these that pertain to your patient. If you do pick a special equipment for discharge, you have to make sure that all the paperwork you need for special equipments for outpatient is filled out by the physician, and even the prescription is prepared by the physician, and it's ready for the patient for discharge. We have a section for off-island, and also for off-island, you have to make sure that all the paperwork is already filled out by the physician, and any equipment needed for off-island is also filled out by the physician. We have a wound care section, and you can, once you click on this and click submit, you can choose the type of dressing and the frequency. Next thing we have is discharge diet. So I'm going to go ahead and pick a diet. I'm just going to pick a regular diet, and you can see all the other different choices you have for diets. If you have a other diet that's not listed here, you can click other diet, and then it'll prompt you an auto prompt to fill in that other diet. Next area is activity and exercise, and these are all the different activities and exercises that you can pick for a patient. If the one you want is not listed here for your patient, you could pick other activities and exercise. For this example, I'm just going to pick no restrictions. The next section we have is release of information. So this is all the different things that can be released to the patient. Make sure you fill out the correct paperwork when you release any information to a patient. If what you need to release to a patient is not there, you have the choice to release other information. The next area of the discharge instruction set is that follow-up appointments and referrals. So there are many different choices for follow-up and a choice for any other special instructions. So I'm going to go ahead and click one of the follow-ups. Now for discharge medications, you cannot pick medications from this area. You must go into Med Recon to put in discharge medications. So for here, you'll choose please refer to medication reconciliation for the meds, and then also please give family and or patient discharge medication prescriptions. If your patient is on IV fluids and the doctor ordered to discontinue IV fluids, we're going to go ahead and discontinue the IV fluids. When you're done choosing all of the orders that the doctor had given you, go ahead and click submit. You're going to get pop-ups with auto prompts to fill out. So auto prompts are just areas where it needs further information. So for this one, it's follow up with. So it's asking me who to follow up with. So I'm just going to put my test doctor here. And you can put follow up with Dr. Pax in 1 week. Or whatever the doctor told you to follow up with. We're going to go ahead and click submit. Another pop-up I got was the discharge diagnosis, and this is just what the physician is discharging the patient with. For this patient, we're gonna pick the discharge diagnosis COPD and click submit. So you'll notice that all of my orders have gone to the order basket and that they're ready to be sent. So we're gonna go ahead and send these orders by clicking the complete sign. It's going to ask, did you make sure that these orders are read back and confirm? We're going to click yes. And you're going to see the orders have been sent when you see this green sign at the bottom. Okay, so for medications, we will go to medication reconciliation and you'll go to the discharge tab. In the discharge tab, you will fill out all the medications that the doctor ordered for discharge. The next thing is discharge summary. If a physician has not completed a discharge summary, we must complete a discharge summary. So you must add a discharge summary for this patient. If you are discharging a patient and the patient is going home with medications, the patient must have a prescription. So no matter what, the patient has to go home with a prescription, so the physician must come in and must provide a prescription for this patient. That is the end of this training video. Thank you for watching.